Welcome back to another video for our human resources in healthcare organizations. I will admit that this is definitely one of those modules where I wish we were meeting live and in person. We're going to talk about legal and compliance concerns in healthcare HR. I will caveat this by saying I am definitely not an employment attorney. I'm not even a healthcare compliance professional, but I am an experienced human resources professional, as you know. And so these are definitely issues that I deal with every day in my career and have over the last couple of decades. The reason I say in specific that this is a module that I wish we were meeting in person is that this would just be a lot more fun if we could have an interactive discussion. I'm going to do the best I can do to offer up some examples and really kind of dig in on some of the current topics in the legal climate. Several of you mentioned during your intro that the legal topics were some that you were most interested in from this class. So I want to make sure that I do this topic justice. All right, so let's get going. What I have done here is provided some of the contemporary topics, why they matter, and some practical considerations. And then I'll also give you some real-time examples from the healthcare setting today. So starting out with wage and hour worker classification, this is definitely a hot topic. Misclassification can lead to wage and hour tax and benefit liabilities. What does misclassification mean? What are we even talking about? So this is the difference between whether or not you call someone a W-2 employee, where you're taking out withholding taxes, and the employer is paying their portion of withholding taxes. And there are all of the Affordable Care Act benefit eligibility rules that go along with W-2 status as well. The other potential classification, if not a W-2, would be a 1099 contractor. You may see in the news, not just in healthcare, but also like in rideshare, right? Like Uber and Lyft drivers are 1099 contractors. There are some states that have questioned that. Maybe maybe Uber should be required to W-2 those employees and withhold taxes and pay the employer share of taxes, right? But this is certainly a hot topic in the healthcare industry. Nurse practitioners, even medical directors, right? Are they employed or are they contracted? And so there are some very specific rules around this. And so this is definitely something that you want to audit on a regular basis as a healthcare HR professional. Taking a look at, making sure that if paying overtime correctly, paying benefits correctly, all the things that matter between the difference between a W-2 and a contractor. An example would be for, in our mental health care setting, in my current company, an example would be a licensed clinical social worker contracted to see clients, being treated as an independent contractor or a 1099, but is required to attend mandatory staff meetings and use the clinic's electronic health record system. Those would be indicators of potential employee status versus contractor status. So it's possible that misclassification could trigger back pay and tax liability. This is why you can see it's so tricky, because who wouldn't be required to use the electronic health record? And so it really, it's really important that the audits take place and you take a close look at whether or not someone's classified correctly. All right. Another really hot topic is pay transparency and pay equity. Lots of new state laws and employee expectations demand visible, defensible pay structures. Gone are the days where you will see written in handbooks that it is inappropriate or against policy to speak openly about compensation. Uh, Pay equity laws, transparency laws make it perfectly okay for two employees to talk about how they're paid, to compare their pay rates, to compare and contrast. And so, really important, and that you publish your pay bands. That as HR professionals, we run internal equity audits and we train managers on consistent pay decisions and messaging. A real time example might be two therapists with similar caseloads discover between themselves pay discrepancies. Especially, we're here in Florida. There are new pay transparency laws in Florida. Um, and so, in this case, these two licensed therapists are kind of left to wonder, well, what is the cause of the inconsistency between the two? If our caseloads are similar, there must be some other reason for it. And so, in this case, maybe one claims gender bias pay inequity, prompting an internal audit and a possible EEOC complaint. So, it starts out just a conversation about pay and could end up potential for a discrimination case, right? So important that we consider the practical implications there. Leave management and ADA, or American with Disabilities Act, and the Family Medical Leave Act compliance. High leave accommodation volume in healthcare, it leaves a risk of inconsistent treatment or retaliation claims, right? So not uncommon to have ADA claims and reasons to take time off work. Some of that, why is it so prevalent, or why would it be considered a high volume or high prevalence in healthcare? I think one, because it's such a large industry, a large there's just such a large number of healthcare workers in this country, and so just follows the numbers. Also, it is a high stress career, healthcare. And so, sometimes the need to take even intermittent FMLA. Oftentimes, healthcare jobs are not the kind of jobs that you can, like most healthcare jobs can't be done from home. And so, trying to manage, maybe a sick, if you have a sick middle schooler and you work from home, chances are you can still pull your work day. If you have a sick middle schooler and you're a nurse working shifts at the hospital, you are likely going to have to call off to stay home with that sick child. So, it's just a different setting in healthcare where you have to be there at the hospital, at the clinic. So, what are the practical considerations, right? Standardize the process for FMLA and ADA, train supervisors, document the interactive process steps, and monitor state leave changes. An example might be a therapist with anxiety request intermittent leave for treatment. Maybe we could have a problem if the clinic denies it without engaging in the American with Disabilities Act interactive process, resulting in a potential disability discrimination case. That interactive process is the most important, right? Like asking that employee, what do you need in order to make this a workable situation? And then, the employer can make a decision. It's not, it's not the sky is the limit. It's not open-ended. An employer can make a decision whether or not they can accommodate that need. But there's no way to make a decision about accommodating a need if you don't even know what the need is. So you have to engage in that interactive process in order to determine that. All right. Data privacy and cybersecurity, right? HR holds sensitive staff and clinical info. Breaches can trigger HIPAA and labor penalties. And so what do? Segregate HR and PHI in the systems. Enforce the least privilege access, right? Make sure that if you don't need to know, if the employee doesn't need the information to do their job, they don't have access to the information. Require multi-factor authentication, maintain vendor business association agreements, and train on data handling. So a practical example might be a clinician accidentally emails a therapy progress note with patient identifiers to the wrong parent. The breach triggers HIPAA notification, obligations, and potential OCR investigation. So, Office of Compliance and Regulation investigation. Important that we have the policies in place so that when it happens, everybody knows exactly. Look, it will happen. We are human. Errors can be made. I think I'm sure that many of you have received notifications that there have been data breaches, whether it was data breaches with your financial information, with your email information, maybe it was a HIPAA breach. But the notification processes have to be followed, and there could be fines involved. All right, workforce safety and violence prevention. OSHA prioritizes healthcare violence prevention. Burnout and injury drive turnover and liability, right? So important that we do our safety trainings, and a part of that safety is also prevention for burnout, mental health safety, as well as, of course, any kind of physical violence. So we want to maintain a workplace that is violence. We want to maintain our workplace violence safety policies to make sure that we're violence free. Conduct annual drills, report incidents, and integrate well-being programs. A potential example might be a partial hospitalization program clinician is assaulted by a patient during a crisis episode. OSHA investigates after reports that no safety training or incident response plan was in place. So really important that we train our team on how to manage potentially dangerous situations. Okay. All right. How about we've been talking a little bit about the use of artificial intelligence. So here's another example of where that comes into play. Automated screening scheduling tools that can introduce bias or privacy risk, right? So there are new laws emerging all the time. We want to make sure that we vet our AI vendors, find out like how are they validating their tools. This is constantly in the news right now. We're hearing reports of bias. Artificial intelligence is trained, right? It's machine learning, and the algorithms have to be trained. And so if they are trained by people with bias, they are likely to have bias themselves. So a real-time example, a clinic might use AI to screen job applicants, but the algorithm may disproportionately exclude therapists from a certain racial background, creating disparate impact risk under emerging AI bias laws, right? So important to really understand the AI tools that we're using, to work with the vendors to find out how they're validating their tools. All right. Regulatory reporting, such as the Affordable Care Act, ERISA, COBRA, those are all important as well. There's the anti-fraud, false claims, and ethics, right? So this is specifically around any organization that accepts federal dollars, so Medicare, Medicaid. If there is compensation or referral structures that can violate the Anti-Kickback or the False Claims Act, that's something that we want to look out for. The practical consideration is making sure that we review all of our physician contracts, executive contracts to implement a conflict of interest disclosure, coordinating with the compliance office, right? So HR typically will help the compliance office to gather any kind of conflict of interest disclosures, whether it's in an annual process, it's part of the onboarding process, but HR is often a partner in that process. So, what's an example? Potentially a psychiatrist who bills for sessions that they never delivered. Maybe we submit for claims under a licensed clinician's NPI for services, but they're rendered by an unlicensed intern. This would result in a False Claims Act violation, right? So we see lots of the occurrence of what we call extenders, physician assistants, nurse practitioners, medical assistants, right? These are physician extenders. And so when physician extenders are used as a part of the workforce plan, that can be great. It can be great for patient service. You will often hear people talk about how much they appreciate the nurse practitioners in their doctor's office, and that those nurse practitioners are able to spend more time with them, and oftentimes people feel like they're cared for more as a whole person when they're working with a physician assistant or a nurse practitioner. So that's great. This model of using extenders is wonderful. We just have to be sure that our models include that people are doing the work that they are licensed to do. So you'll hear a lot about license scope and like who does what work. That is particularly important in job design and in making sure that we have the right people carrying out the right work so that we don't end up in a false claims situation. All right, and then of course, diversity, equity, and inclusion, any harassment prevention, and concerns about workplace culture. And so those are all important topics, right? So what are the practical implications there, right? Making sure that we update any anti-harassment training. Oftentimes, each state has some specific training that they require. And so we'd need to make sure that state by state we are doing the right training. Refreshing our EEO policies as things change over time. Make sure that we're auditing promotions, pay by demographic, and communicating our DEI metrics, our diversity, equity, inclusion metrics. All right. All right, so these were the hot topics. These are the list of things that we find to be most hot topic in healthcare HR. What I want to do now is introduce you to a tool that often human resources will use in partnership, oftentimes with the compliance office. And this is the risk matrix tool. And I wanted to give you some examples of how the risk matrix tool can be used in some of these areas that we just talked about. So first, just kind of orienting, right? So in healthcare, risk matrix is most frequently used by compliance and risk or by quality and safety. HR can definitely use this tool to be more proactive. So instead of waiting for problems to happen, let's take a look and do an assessment and decide if there's anything that we can solve ahead of time. And so just, orienting ourselves to the matrix, right? So down the left axis, we have impact, right? So if the impact is very low, there may be negligible consequences, right? Or low consequence, moderate, significant, and then of course, catastrophic consequences. And then across the top, we have the likelihood. Well, we're assessing what is the likelihood that this could happen. And we have everything from very unlikely all the way over to very likely to happen. All right. So thinking about this matrix, I want to give you some examples. And these are some of the same topics that we've just talked about. So we talked about like the misclassification of employees, right? What if we have somebody classified as a contractor versus a W-2 staff member? So in a healthcare setting specifically, what is the likelihood that this could happen? It's pretty high actually, because we actually do use a lot of contractors in healthcare. And so this is definitely one to be looking out for. So high likelihood, very likely to happen. That puts us over there in that anywhere from critical down to moderate, right? We'll have to see what's next. Would be the impact to the organization if it was found that we had misclassified? High. The impact is high. And so we're saying that this is a critical situation. So if we find that we have misclassified, it is something that we need to take care of immediately. And so, more importantly, we need to prevent ever misclassifying. So we need to have regular audits, and we need to make sure that we are telling folks in their offer letter exactly how they are classified. You may remember that from your own offer letter, being very clear about your classification. All right, let's do another one. Inconsistent American with Disabilities Act or FMLA leave administration. The likelihood is probably medium. The impact would be high, right? And so we need to standardize our leave documentation and train supervisors in that interactive process. Because if it is found that we are systematically discriminating against people with disabilities or folks who are eligible for the Family Medical Leave Act, that would definitely be, there would be high consequence to that. Pay equity and transparency violations, right? It would be a medium likelihood that it could happen and medium impact if it does. Why medium instead of high? It seems like a pretty big deal, but it can usually be remedied very quickly. So the impact often isn't widespread because as soon as you find it, you can usually get it fixed very quickly. You want to run annual pay equity analysis to avoid this happening, and you want to communicate salary bands to managers so that they know the right level to be working in, the right ranges to be working in. Another example, failure to comply with state licensing or credentialing, right? The likelihood is medium that it could happen, and the consequence or the impact would be high in that case, right? Having anybody practice any type of healthcare without the proper licensure is a really big deal, right? You wouldn't want to have a doctor who is not properly licensed making your healthcare decisions. You don't want a mental health worker who isn't properly licensed guiding you through your mental health treatment. And so definitely a really big deal. So we need to maintain centralized license tracking system, making sure that we have automated renewal alerts so that we don't miss anything. There are a lot of states that require that you use primary data to verify licensure. What does that mean? No third-party databases, right? So if you are licensed in the state of Colorado, you would go to the state of Colorado's database to check on that license as a healthcare organization. You would not want to use third-party verification to do that. And so, you might use third-party verification for background checks. That's typically, criminal background checks. That's very, very common. Checker, Equifax, right? All those systems that are out there. But medical license verification is typically they require that you use primary database information. So you're coming directly from the state, directly from the Board of Licensure. All right, and our last example for today's module, back to talking about AI bias, right? So how would we think about AI bias, especially in hiring or performance systems? So we think that the likelihood that we would find AI bias is fairly low, because we do believe that, this is something that the vendors are addressing, and has been, top of mind as AI has been rolling out. The impact would be medium, right? So we want to validate that the algorithms, easy for me to say, that they're being evaluated for bias, and that we're documenting how they're being used and making sure that that we see the documentation for reliability and validation. Not so different than how we've been using assessments and surveys over the last couple of decades, right? We've been using a variety of tools to help us with recruitment and hiring, whether it be like type indicators, things like extended disc, or different sales skill assessments that you often see used. So we know how to check for validity and reliability in these tools. They've been used for decades, and we can apply that same knowledge to the AI algorithms. All right. Well, thank you for attending and listening to another module. Again, I really wish that we could have had more interactive discussion here. It would have been a lot more fun. Certainly for me. I suspect it would have been a lot more fun for you too. But thanks, and I'll see you over in the discussion thread. Take care.